I entered Gaza on March 6th, around 6 o'clock in the evening. My mission was for medical aid, sending aid to a certain hospital that they have severe shortages. And I stayed in Gaza in hospitals most of the time. Never left the hospital except when transporting from one hospital to another. And the entry to Gaza was coordinated and supervised by United Nations and the World Health Organization. We started 12 years ago, where we have different catastrophe or crisis. And I got to introduce to the surplus of medical supply that most hospitals in local BC tend to get rid of, or they became a surplus that they no longer need due to multiple reasons. Among them, or the main one, is they no longer meet the Canadian standard of healthcare. And they are still in good condition, and we want to make sure that they can be used wherever is needed around the world, and they cannot afford. So we established that team efforts in collecting and organizing, sorting, and preparing suitcases, and sometimes containers of aid, and send them to places where they cannot afford. Those are right now with Gaza is about 14 countries that we have delivered to. And when it happens that I was passing by Egypt, and I took with me 2 suitcases. And by the time I managed to find medical aid groups that are going inside, it seems to be one of them is short of logistics, and I joined them. Movement of aid into Gaza is choked by long delays and waiting, and sometimes many reasons, or trying to prevent it from going inside in the flow. What we are doing, or what I'm doing, is filling the gap. The short-term shortages that the hospital are facing, we try to get those with volunteers who are entering Gaza to help. Those are medical volunteers. And that's where the gap that we're trying to help fit in. The demand inside is huge. I've seen the lineup outside the border. It used to be only 100 trucks per day. I believe they increased it a little bit, but it's nowhere meeting the needs inside. I have been to a couple of hospitals, and they are in dire need. All of them, even now, as I send them some of the medication in one of the maternity hospital, and children inside. They were so excited and happy, and they thanked me so much. You could see the tears in their eyes, that 5 months, almost 150 days, and they haven't even seen meat, or they are, all of them, even the medical staff, are malnourished. Sending inside is very difficult. It has to be coordinated with the United Nations. It has to get approval from the 3 involving countries, the Egyptian, the Israeli, as well as the Palestinian Authority, in order to grant access. 2 suitcases, I brought them with me from Vancouver to Cairo during my trip, and they were medical supply collected from BC. When I went into Gaza, I had with me about 8 to 10 suitcases, wheelchair, and also icebox of insulin, because there were shortages of insulin for some of the patients, chronic patients who are inside, and they cannot find the medication. So that's I can explain to you what's inside them. There were wound care supplies, such as dressing, gauze, cottons, as well as some other bandages and suture that is needed in order to stop the bleeding, or to make sure that the injured people are stabilized. The second category is the burn care. These are items used when someone is 2nd degree or 3rd degree burned. And this is special non-adhesive dressing, as well as dressing with Vaseline and some other cream or ointment that can be used for the burn patient. The third category is medication, primary care medication for children, such as a painkiller or ibuprofen, in which they can reduce the fever for kids. Antibiotic, there's a lot of need of antibiotic because of the wound and the infection happening afterward. Also for infant and pediatric, there were a list of items, medication they want. In addition to anesthesia, you might have heard some of the doctors were complaining inside that they've been doing operation or amputation without any painkiller or local anesthesia. So I managed to secure that all from Egypt and brought it with me inside. Although it's highly appreciated and they were having a lot of shortages of supply inside, let it be clear, it's a drop in the bucket. I'll give you an example. One of the clinics that we visit, they used to have approximately on a daily basis between 100 to 300 patients, out clinic patients. Now they are receiving between 2,000 to 3,000 a day. So these supply could last in 6 hours or 12 hours in one clinic, not even a hospital. So there is a high demand inside. The first thing I saw is I love Gaza, and on top of it, I can hear the drone hovering around. And I tried to magnify it with my mobile, where all of a sudden I see the taxi driver around shouting at me, "Don't take a picture of the drone, they will shoot at you." So I was scared, and immediately I turned off my phone. We head into the streets of Rafa. It was about 6 o'clock or after 6, dark. There is no lights in the street. There is no electricity. The area where we start to venture in, you could see a lot of people. Almost feels like as if it's a zombie walking the street in crowded people. The amount of internally displaced in Gaza is huge. In some area where the town used to be having 80,000 inhabitants, now they have near 1 million in the south of Gaza Strip. So the demand has increased by tenfold, while the medical resource and supply has not.